All right, so I am Tessa, and this poster is Breastfeeding and Access to Breast Pumps in Southeast Missouri. Again, my name is Tessa Baum. I'm an M3, and I worked with Dr. Sarah Calhoun and Dr. Laura Morris on this project. So the purpose of this project was to investigate the prevalence of breastfeeding and feeding pumped breast milk among people seen for obstetrical care in Sikeston, Missouri, and to identify barriers to successful breastfeeding and access to breast pumps. And just to kind of orient everybody, Southeast Missouri is in Scott County. Sikeston, Missouri is in Scott County in Southeast Missouri. Right down here, it's this blue county near the boot heel. So a little bit of background. Breastfeeding promotes benefits for both infants and breastfeeding parents. It's been shown to reduce risk of infection and obesity in children and is associated with lower rates of breast and ovarian cancer in breastfeeding parents. The Scott County Needs Assessment of 2019 showed that the infant mortality in Scott County was 10.7% compared to 6.4% in Missouri overall, and also showed that the breastfeeding rate in Scott County was 56.2% compared to 72.9% in Missouri overall. And so this data was from 2019, but back in 2016, the Missouri Delta Medical Center implemented increased education about breastfeeding for patients and staff through a grant with the Missouri Foundation for Health. They were able to kind of create educational material, hire a lactation consultant, and they found that these efforts increased their hospital breastfeeding initiation rate from 20% to 60%. And so that's kind of where I was going into this project. So for this project, I had data from 97 people surveyed between October of 2020 and January of 2021 at prenatal and postpartum appointments at the Missouri Delta Medical Center in Sikeston, Missouri. And this data were entered and managed via REDCap. So we compared the following measures among parents who were directly breastfeeding or feeding pumped breast milk and those using human milk substitutes. So we looked at prevalence of breastfeeding or feeding pumped breast milk, reasons for feeding plan, sources of education, prevalence of breast pump usage, sources of pumps, and then barriers to breastfeeding. And the results of our survey showed that 40.21% of participants reported breastfeeding directly or feeding pumped breast milk, and 92.31% of those breastfeeding reported using a pump. So looking at this table right here, this bar represents that 40.21%. So this captures the 39 participants who indicated that they were feeding their infant breast milk, either via direct breastfeeding or using pumped breast milk. And then you can see that the percentage of participants who indicated that they were breastfeeding directly is a little under 30%. Those feeding pumped breast milk is a little over 30%. And then the vast majority, close to 80% of participants, indicated that they were feeding formula or human milk substitute. And then looking at access to breast pumps, one of the things I was curious about is where are participants accessing these resources? Most participants obtained their pump through insurance. So that was 64.1% of participants, while others purchased their own, 23.08%, received one through WIC, 10.26%, or as a gift, also 10.26%. And so then another thing that we wanted to look at was education source on feeding plan. So overall, most participants indicated, or the education source that was most indicated was health professionals or WIC as a source for education on feeding. Participants using human milk substitutes were more likely to report education on feeding from WIC than other sources, or than other participants with different feeding plans. And then kind of looking at this same population, those feeding human milk substitutes, they were all also more likely to report convenience and work as reasons for that feeding plan. And then looking at breastfeeding parents, they were more likely than those feeding human milk substitute to report health benefits. So up here, health benefits and actually cost as a reason for their feeding plan. But lots of participants indicated that preference was also a factor in their feeding plan, which makes a lot of sense. Just to address kind of this other category as reasons for feeding plans, some of the reasons we saw were maybe a medication that a patient was on, so then they chose to feed formula, problems with latching, or milk supply or production, and so choosing to feed formula. Those were kind of the big categories indicated in that other category. And then we also looked at barriers to successful breastfeeding, returning to work, inadequate milk production, and then work schedule were reported as the most common barriers to successful breastfeeding. And you can see those percentages up here. So looking at all of that data, obviously this was a study that I did during my clerkship time, from October to January while I was down in Sikeston. But looking at this data, the results that I found suggest that the breastfeeding rate in Southeast Missouri remains less than average for the state overall, and that most of those feeding breast milk are actually using a breast pump. We also found that WIC was overall the most reported source of feeding or of education on feeding plan. And this, we thought, suggested an opportunity for WIC to be teaching parents about and reinforcing those benefits of breastfeeding and feeding pumped breast milk to patients. So not only can parents go to WIC for formula, but we see that they can also be accessing breast pumps through WIC. So kind of using that resource to reinforce those benefits. And then health professionals was the second most reported source of education on feeding, suggesting that what the work that Missouri Delta Medical Center is doing is having an impact, is important, and obviously should continue to educate patients on the benefits of breastfeeding, and kind of having that time. So that is my presentation. I also wanted to just give acknowledgement and huge thank you to Melissa Kelly, who is the lactation consultant on site in Sikeston. She was a huge help, and I couldn't have done it without her. So thank you.